All right, so hip bursitis, what is it? And how do you get rid of it? What are some of the first steps you can do to get rid of it? And what are some things you shouldn't do? So the way I like to describe hip bursitis or any kind of bursitis is an internal blister. That's kind of how I see it, right? Meaning that it's almost like a little pocket of swelling, just like a blister is, let's say, on your hand. It's your body's way of letting you know that there's been some pressure there and that it's irritated. So there's a couple different things that you can have with pain on the side of your leg around the outside of your hip here, but true hip bursitis, or what they would call greater trochanteric bursitis, is right on the bony part, okay? So not back here into the glutes, not a little bit further down the leg, but right there on the bone. You will often have pain with lying on your side. So this bothers people even at night because they feel like it's pressure there, just like having a blister on the side of your leg. The other way people often feel it is with walking or running. Those two things tend to either become the cause of why you get it in the first place and an ongoing irritating factor. And so why this happens is that this bony part here, there's tissue that goes over top of it, muscles and tendons, and it's sort of like this red band here like this. And so when your leg moves into this position, or let's say you're walking and your hips are going side to side, right? People tend to be a little more side to side motion in their hips, or walking and running will get this. Then it's just like this band you can see as I go this way, see how it stretches like that, and it puts pressure on there, and that's how that bursitis forms, okay? The body's just letting you know, like, hey, there's some tightness here that we don't like. And again, it's right there on the bone. So that being said, right, one thing that you don't want to do with this is to try to stretch it, right? So people often, like, one of the first things you do when you feel pain is to try to stretch an area, and sometimes that's good, sometimes that's bad. But in this case, that's bad. You wouldn't want to do this and kind of try to stretch in there, or lie down on your back and bring your legs across like this and try to stretch that area. There's a problem there because there's already too much pressure. You don't want to put more pressure on it. The way to fix this is to get your leg more stabilized, especially in a single leg strengthening position, right? And so if your hip and glute muscles are doing a good job of stabilizing your leg, then there's less movement side to side, then slowly your symptoms will decrease. So the exercises I want to show you are all about getting stabilized in the hips, in the glutes, to avoid that side-to-side motion or the leg coming in. And first we'll start with one kind of a beginner one that you can do lying down. It's basically a different way to do the bridge, where you would take a band like this, put it up over your knees, and as you bridge up, push out, right? So we're trying to strengthen this outward motion as opposed to coming in, right? So just like that, working on, as you come up, pushing the knees out, feeling it work into your glutes and hip. And, you know, a good number for those is like doing 15 to 20 reps, 3 to 4 sets. The next one I want to show you is a single leg exercise. And this is a lot of ones that we do initially when we work with runners to kind of test to see how is the strength of the outside. So it's a little bit of a test, but also can be an exercise. So when people are running, what happens a lot of times, as their muscles fatigue in their hips and glutes, and they take these steps in, these legs start coming in like this. It's sort of like the knees are coming towards the middle of the body. And again, that's creating the pressure on the outside. So this exercise would be just standing on one foot, trying to stabilize over the hip, keeping your pelvis level, and then just going down, trying to tap the heel and come back up without that leg curling in like this, okay? So if you feel, it's a good idea to do this one in a mirror. If you feel that you're going in like this, then really try to work on stabilizing, pushing the knee forward and keeping it forward and out. hips stable, just going up and down, and you should feel that outside of the hip working while you do this. So again, that's one you can do on both sides. Again, 10, 15, 20 reps, several rounds of that. Another one that we like to do is, again, with a band, kind of a thick fabric band like this, is diagonal heel taps. So with this, you're going to stand in this position. You're going to put your opposite hand on the opposite knee, and you're going to do that to keep from rotating your body. And then you just want to tap your foot back and in. So kind of at a diagonal as I'm doing. And as you see, all the weight is on this hip. I'm trying to stabilize this leg. The band in my leg going out like this is trying to pull this leg in, so I'm having to work to keep it out. I'm not transferring my weight into this back leg, stepping back, weight into that foot. I'm keeping all the weight in this foot, and it's just a tap back, tap in. Pretend there's like an egg on the end of your toe that you don't want to crack. Just back and forth like this. This one, again, 20 to 30 reps, and I would do it 2 to 3 rounds. Okay. So obviously do that one on both legs. The last one that I want you to try is what we call hip airplanes. This one's really challenging. Hopefully I'll be able to do it. All right, I'll demonstrate on my right leg. It's the strongest one. So hip airplane, again, we're working on single leg stability because walking and running is single leg stability. You're going to stand like this on one leg, and then what I want you to do is rotate back like this, trying to keep your balance, and then in like this. All right, so sort of like a airplane that's waving its wings a little bit. And the slower you go, the better. It's really good for balance, obviously. Doing 7 to 8 on each side is a good place to start for that. So the idea with this, again, is don't stretch when it's inflamed, right? It just increases the pressure. And start by doing a lot of hip and glute stability exercises. That's a good place to start for getting rid of this. If the walking and running is bothering you, try to decrease that just a little bit, or only do as much as you can without it bothering it. And but yeah, that's hip bursitis. So if you're having an issue with this, you can please go ahead and comment below, and we'd love to hear about your issue. And then if you're local to us here in Roswell, Georgia, we'd love to see you as a patient too. So anyway, that's hip bursitis. I hope you learned something, and we'll see you next time.